And good afternoon, everyone, and happy Friday to those who observe that. Thank you for joining us. I begin with the medical report. Today, we are reporting 2,432 new cases over the last 24 hours for a total of 90,369 individuals with COVID-19 in Illinois. Included in that 90,000 plus total are 4,058 deaths of Illinoisans, of which 130 were reported in the last 24 hours. As of last night, we received report that 4,367 individuals were in the hospital with COVID-19. And of those, 25%, actually 26%, 1,129 individuals were in the ICU and 675 patients were on ventilators. To date, 538,602 tests have been performed. 26,565 were reported over the last 24 hours. That gives us a 9% positivity rate for the last 24 hours. As we look to expand testing in Illinois, I want to make specific mention of the need to test pregnant women who are admitted to the hospital for delivery. This is for multiple important reasons. First of all, many of the symptoms associated with labor can mimic or cover up symptoms of COVID-19. So we could easily escape detection with just symptom screening. But we also know that many people with COVID-19 are completely asymptomatic. Early data from hospitals in Illinois that have already implemented universal screening of women admitted for labor show a positivity rate anywhere from 3% to 12%. Knowing if a woman giving birth has COVID-19 will help inform the medical plan, help inform medical decisions that need to be made, including those surrounding the use of the appropriate personal protective equipment, PPE. That will help protect not only the pregnant woman, but also her healthcare providers and, in fact, her newborn baby as well. Early data show that after birth, women may be at further risk from additional complications if they have COVID-19. So knowing of the COVID-19 status is essential to be able to look for those potential complications. Knowing if a mom has COVID-19 will also help physicians determine how to best provide care for that newborn baby. A mom should know whether she's at risk of passing the infection to her baby after they leave the hospital and help her take steps to protect her infant. Testing is crucial in all situations and all aspects, and we look forward to increasing and expanding testing opportunities and capacity across the entire state. You should know how hard the state team has been working on increasing testing capacity. We have been encouraged, to put it lightly, by an amazing leader in the person of J.B. Pritzker, who understood very early the importance of testing and has done all that he can to support the team and increasing our capacity.